to say is, despite the events of the last few days, medical bankruptcies will continue at an alarming rate in West Virginia. And 4 West Virginians will die every week because they don't have insurance, which to me is a simple question of morality as a physician. In addition, regarding economics, a reevaluation of the cost of the state of just the Medicaid expansion component of the Senate healthcare reform bill seems to reveal that the state, the cost of the state from the years 2014 to 2019 will be only a few $1 million a year. And this is certainly an economic reason to think about this whole issue. Now, for that small cost, as CCRC actuaries has projected, they noted that for this small investment, the citizens, the healthcare providers, and businesses of the state over this 6-year period will reap approximately $4 billion financial benefit. If you consider all the components of healthcare reform legislation, this total savings from 2014 to 2019, as projected by the CCRC actuaries, would be around $15 billion.
I've said before, I'll say it again, the promise of healthcare reform and health insurance reform is the promise of freedom. With aggressive reforms, people will be free to create and to innovate. That means jobs will be created. And I think that a national attitude of depression about the future will be replaced by a bright and hopeful prospect for regaining America's place in the world as an economic
I've worked
power.
on healthcare policy with many of the people here for many years. In fact, that's where I think my hair went. You hear some people talk, the universe has somehow changed in the last week. I don't think, the sun still seems to come up in the same general direction and go down in the same general direction. As of Monday evening, there are about 46 million Americans without health care coverage. As of Monday evening, there are over 200,000 West Virginians without health care coverage. You know what? It's Thursday afternoon and that hasn't changed yet, nor is the need to pass comprehensive health care reform. Passing legislation is never pretty, except maybe here at our beloved Capitol, but in general, it's never pretty, and no piece of legislation is ever perfect, but we cannot give up now. We need to keep pushing for comprehensive health care.
Since Scott Brown was elected in Massachusetts Tuesday evening, a lot of people suggested that perhaps we ought to scale back healthcare reform, concentrate on insurance reform, and in particular, eliminating pre-existing conditions. And I'm adamantly opposed to pre-existing conditions and the problems that they create. The problem is if you only eliminate pre-existing conditions, you will probably make things worse. That's because there'll be anybody who gets sick. You don't have to buy insurance until you get sick. You get diagnosed for cancer, you go to the insurance company, you buy a policy, they can't apply a pre-existing condition, you get treated for your cancer, you get cured, you drop your insurance until you have another need for health insurance. So we'll actually drive up the cost of health care and not drive it down.
Tuesday was not a referendum on health care. I want to congratulate U.S. Senator-elect Brown for his election. He won it. He won it fair and square. He won it maybe because he worked hard. That's what we'll find out later on. But that election was not about health care to them. It's about a referendum from the voters that says, you're not doing enough. You're not taking care of the people that are sick. You're not taking care of the jobs that are out there. You're not taking care of the banks that have failed us. Wall Street has taken over. They have failed us. We are not doing enough. We are going to stand here as we did in the early 90s, and here we are in 2010. We're going to stand strong behind the health care plan that provides health care. Unlike what Senator Brown is going to have, he's going to have a very good health care system that he's going to be relying on now, but he's going to walk in where he's going to see a 45 million people without health care, and he's gonna have to address
I
that
have a
issue.
statement here from Senator Rockefeller, who faxed a statement in especially for this press conference. There is not a question in my mind that the House and Senate bills would make a big difference in the lives of West Virginians and all Americans. While politicians and politics come and go, the need for real health reform remains, and I will keep fighting the good fight to pass health care legislation this year.
Here that helps us without relying on the federal government.
I'll make a few comments. First, I'm not convinced that the House and Senate are in retreat. They're simply looking at what the options are at this point, and hopefully will, as Senator Rockefeller pointed out, pass comprehensive health care reform this year. It may not be next week. As far as what we can do in the state, we have a few initiatives that are in place related to medical home through the Go Health component of the governor's office. But in terms of expanding Medicaid, in terms of expanding coverage to those who are above Medicaid eligibility level, and dealing with insurance companies and making the delivery of care more efficient as is promised comprehensive health care reform, that's a tough challenge in the state. Massachusetts has done it in one way, but the dynamics were particularly unique there. But the hope of doing anything that would truly help the problem we're talking about in this state in the short term, I think is probably...
Positions, do you think the process needs to be more open and transparent?
This is typical in Washington, D.C. They negotiate through this to try to make a deal. The opposition said that they didn't open it up, but every one of them said we need to kill this health care bill. Now we're going to have Republicans that oppose this. They're going to have to look themselves in the mirror and say, what do I do now because it's in my hands? Republicans are going to have to come up with their own ideas as to what they think is going to make this health care system work. If they fail to, they're failing the 45 million that do not have health care. They're also failing the ones like the ones in this room here that have health care, because as the health care costs go up, it's going to go up so high that it's not going to be a Cadillac plan. It's going to be a group of people without health care, and we're maybe trying to take care of ourselves, or we're calling Dan Foster to take care of all of us. So they're going to have to do some soul searching too.